I want to take the next several minutes to talk to you about your clinical experiences during your intern year at Riverside. Riverside serves as an independent academic medical center. What that means is we don't have a medical school attached to the walls of our hospital, but we do have several official affiliations, including University of Toledo, Ohio University, OSU, and NeoMed. In addition, we have a number of medical students rotating from a number of medical schools across the country. The bottom line for you is that when you are on your inpatient rotations at Riverside, you will have medical students with you. And that way you can start to make that transition that I think is extremely important from somebody that's been a pure learner to somebody who's both a learner and educator. In my opinion, one of our greatest strengths is our teaching faculty. We have a very large volunteer faculty who come from a number of different clinical programs across the country. The things that attract them to Riverside are certainly not the oceans and mountains that are in Columbus, Ohio, but medical education is important to all of us. The reason that people come here is because they want to be involved in teaching. They don't necessarily want to have to fight for their next NIH grant, but medical education is so part and parcel, it is so important and integral to what we do at Riverside. People that don't want to teach, they don't come here or they don't stay here. A little background about me. I grew up in Northeastern Ohio. In fact, I did everything from kindergarten all the way through the end of medical school within about a 20-mile radius of one another. At that point in my life, I thought I never wanted to be in Ohio again, so I moved to Charleston, South Carolina, and did my residency and fellowship at MUSC. A number of factors brought me back to Columbus, Ohio, and to Riverside, including some of the factors I just told you about for other faculty. I joined practice in 2006. I became the medical director for our simulation center from 2011 to 2017. I've served as a GMAC chair for two different terms from 2014 to 2018, and I've taken over the transitional year program director in 2015. So although this is my 6th year of recruitment as a program director, I've been involved with medical education at Riverside for a while. I do want to take a moment on this slide as there are several aspects of Riverside that are somewhat unique and provide for a unique intern experience. First, I want to talk about the things that aren't on the slide. This represents the totality of our GME department. What you don't see on here are a number of subspecialty medicine fellows, anesthesia residents, radiology residents, etc. As a result of that, you don't have this dilution of experience where there's an increased autonomy for your experience throughout the course of the year. We do have 15 internal medicine residents per year, 6 family medicine residents per year, 5 OB, 4 surgery. We have 4 preliminary surgery. We do have a dermatology program with 2 residents per year, and a psychiatry program that's in its 3rd year of recruitment, and at full complement will have 3 per year with a total of 12 residents. We do have some subspecialty fellowships, including sports medicine, hospice, and palliative, along with some non-clinical fellowships, such as patient safety and quality improvement. But if we come back up to the prelim and transitional programs, there's the 7 with the 9 in parentheses is because we have a total of 9 spots, but 2 of those are going to be allocated for our integrated derm program. But the prelim and transitional years function as one large program. So you can look at it as one large 21-person program. And with that, you actually outnumber the total number of internal medicine categorical interns and surgical interns combined. The reason that's important is that you are an integral part of the way that we deliver care here. There are some hospitals and some programs where there's a large number of categoricals, and then there's a very small number of prelim or transitional spots. It is easy to be the forgotten few if that's the case. Here, when you're on a core rotation, the expectations, the obligations, and the opportunities are exactly the same. When you are on a core rotation, if it's your patient, it's your procedure. And from my perspective, before I was in this role, it could be 6 months before I knew who was in what program, because for the things that I do, for pulmonary, for critical care, the expectations and the obligations are exactly the same. Quite frankly, now that I'm in my role, my expectations are actually somewhat higher from our prelim and transitional residents because we get really great people every year and I expect a lot out of them. As I mentioned before, our prelim and transitional program function as one large program. We do have 2 different buckets because of ACGME caps. Our preliminary medicine falls under internal medicine for an ACGME cap, and our transitional year is its own ACGME number. That being said, The programs are essentially identical. The number of core rotations, the number of electives that you do are exactly the same. If you are interested in Riverside, it behooves you to rank both programs, and we will rank you for both. The things that we're looking for are fairly simple. We expect that you're going to have good medical knowledge. We get people that have really good scores and have done really well in school, but that by itself is not enough to make a good intern. We want people that are going to have a positive attitude and a strong work ethic. Next year is going to be no different than anything else you've done. You're going to get out of it what you've put into it. Although you've worked really hard during medical school, the formative time of the physician that you're going to become is going to start during your intern year, and it's going to carry through your categorical program. It's really important to make the most out of that. Our goals for you are also fairly simple. We want you to have a solid base in medicine. Even though you're going into something that's going to be different in your advanced program, if you were to have a person collapse on a plane, or if you were to have a family member ask you a medical question, we want you to feel comfortable fielding those questions or those situations. But we also want you to be able to expand your area-specific interests. You're going to have a unique opportunity next year to do rotations and electives that may have an impact on your future specialty, but you won't be able to do in your advanced program. For example, if you're going into dermatology, doing things like rheumatology or infectious disease, or if you're going into radiology, things that have radiographic or clinical correlates such as neurology or pulmonary, or if you're going into anesthesia and you want to have extra ICU experiences or cardiac imaging, this is your time to make the most out of those experiences so that you can be the best advanced resident possible. We do allow flexibility in the curriculum so you can have a balance between rotations that have more rigor and difficulty with some lighter rotations. More than anything, we want you to be prepared for your PM.TY year. Although the workflow and vernacular is going to change in your advanced program, there are concepts that are ubiquitous to the medicine. Being able to effectively and efficiently gather subjective and objective information from patients, being able to put that in a meaningful format in your brain to do presentations, and not only that, but actually being able to take that information and start to formulate assessments and actually intervene on that information and formulate plans. That is a concept that is going to be important no matter what you go into, whether you're an intern in your cardiology rotation or whether you're a consulting physician talking to a referring doctor. Those concepts are really important to grasp during your intern year, and we offer the breadth of clinical experiences to do so. Our curriculum design consists of 13 4-week rotations. You'll do 2 months of general medicine, 1 of ICU, 1 of cardiology, 1 of ER, 1 of ambulatory medicine, which leaves 10 weeks of medical subspecialties, 2 2-week blocks of night float, 2 weeks of night ICU coverage, and that leaves 12 to 13 weeks of general electives. I know that general electives are extremely important to you, so you can get the experience you need, and they're important to us as well. This represents a number of electives that are hardwired within the walls of the hospital, but is not an all-inclusive list. We've had a number of residents that have designed other elective experiences, either within Riverside or at an outside institution, as you are allowed to do a 4-week outside elective with us. These can either be done as 2-week blocks or 4-week blocks. The bottom line is that if there's something that you have an interest in, we want to help facilitate that so you can get the best clinical experience possible. I know that research is important to a number of our applicants, and a number of you have active research projects that are ongoing. We do offer research as one of our elective blocks. This can either be done through the walls of Riverside or as an outside rotation. If you're trying to finish up a number of projects that you had the best intentions of completing during your 4th year, we do offer that as an opportunity to complete some of those. Several people actually have more of a physician scientist track in their future, and they already have approval from IRBs at their future institution and have a mentor, and so they will work through there. And we also have a number of ongoing projects that you can have substantive input with Riverside, as we do have a full-time research institute that works with our residents. go through some of our samples of services. Ambulatory medicine will either happen at the Riverside Family Practice Center or the Riverside Community Medicine Center. They're similar in that it'll be 4 to 8 patients per half day with a 4-week block rotation. There's no call, no weekends, and our EMR is integrated within Epic. Emergency medicine has been honestly completely revamped over the last couple of years, and now is an outstanding rotation with a wide breadth of different clinical experiences with exposure to trauma, NIH, stroke assessment, sepsis, acute coronary syndrome. You'll do a total of 14 10-hour shifts during that time. There's also built-in didactic and simulation education as part of your experience. General internal medicine is done in a number of different potential clinical settings. Clinical medicine, which is the classic clin med that you probably did during medical school, consists of a resident-driven service with a fair amount of autonomy. That includes 2 PGY3 residents, 2 PGY2 residents, and 3 interns, along with 4 medical students. And we also have a hospital med service that either occurs through COPC or Med1, which are our 2 hospitalist groups. That is much more of a nuts and bolts of hospital medicine that works on throughput and number of common medical diseases. All of them are excellent rotations with different experiences, and you'll have an opportunity to see each of these. Typical day, you'll come in at 6:45 and sign in from night float till 7:15. Morning report happens from 7:15 to 8. Resident rounds occur from 8 to 10. Attending rounds happen from 10 to 12. And noon conference occurs from 12:15 to 1. The rest of the day is the dotting of I's, crossing of T's, where you're getting admissions, finishing rounds, etc., and you're signing out to night float from 4:45 to 5. Cardiology offers different experiences as well. We have an inpatient interventional service that involves advanced heart failure therapy, cardiac ICU patients, and we also have a consultative service with our Blue service that involves advanced imaging and echocardiography that can be done as an elective. Critical care medicine is probably one of the tougher rotations you will do, and while I'm biased, I also think it's one of our best educational opportunities. We have a 31-bed ICU that consists of 2 teams, each with 15 to 16 patients. Each is led by an upper-level resident. We do have night float and days off incorporated within the schedule. There's in-house critical care attending support 24/7 so that nobody ever feels like they're left on an island. The days are a little bit longer with this, where you sign in from night float from 6 to 6:15. Resident rounds occur from 6:15 to 9. Attending rounds happen from 9 to 12. And the rest of the day is getting admissions, doing procedures, etc., and you're signing out to night float from 5 to 6. You are also excused from any morning reports or noon conferences during that month. And finally, our night float schedule, which I want to take a few moments to talk about. I am sure that there are programs that you're looking at that do not have a night float experience. I will give my personal opinion about this, where I think night float is extremely important no matter what you're going into. It was important for the physician that I became. It is important in the way that you strip away some of the layers of safety and that you learn how to deal with undifferentiated patients, and most importantly, learn how to triage a number of different needs from nursing staff or patients at the same time. No matter what you're going into, learning how to balance your day and being able to triage the urgency and importance of different requests is going to be important. The other nice thing about our night float is that we have kept all of our daytime and nighttime coverage separate, so we have not gone back to a call system during this. Therefore, when you outside of your night float responsibilities, you will not have any nighttime duties.